This is the joint immobilization station. You will probably find your live patient with their arm self-splinted against their body like such. And this will tell you that they might have a shoulder injury to the right arm. So we are going to apply a sling and swath. So I'll start like every station. I have my PPE on. And for all the splinting stations, I'm going to check CSMs. So I will check a pulse, circulation, I will check motor, can you wiggle your fingers, and sensation, which finger am I grabbing in the affected limb. And then I will ask my patient to self-stabilize their arm. So I can either have a partner hold the arm here, or I could ask the patient to use their other arm to hold it in place. But we would be keeping the arm like such the entire time. We will now apply a sling and swath. For the sling, I will take my triangular bandage, and on the, some people call it the fat corner or the thick corner. It's opposite the longest side. It's the one corner that's different. I'm going to tie a knot. This will help me create a pocket for the elbow. I want to have a little tail that's about 1 to 2 inches long. And I will put the patient's elbow right in that slot. Okay. And I will bring the ends of the splint up around the patient's neck to tie around. Okay. So I have both sides of the splinting material pulled around. I'm going to make sure the whole arm is secure. Pull up all the loose ends and tie my splint. Okay, so that's my sling. At this point my patient's arm is not fully secured because their shoulder can still move. So the next step is to tie a swath around the patient's body. So I'm going to take another triangular bandage, basically make it into a piece of rope, go all the way around the patient, including over top of the affected shoulder, the arm of the affected shoulder, and tie this behind the patient's back. Okay, at this point my patient's arm is secured, the shoulder is secured. I will now check CSMs, so circulation, sensation, and motor in the right arm. And that's it for this station. One other thing you might come across in the field is a patient who has a long bone injury to the forearm. So you could adapt this station pretty easily to splint a radius ulna injury by also implementing what we call a SAM splint. And this is just an aluminum malleable splint. It has some aluminum on the inside and then it's padded on the outside. And these splints, when you fold them long ways, or what we called hot dog style back when I was in school, if you fold them that way, they become much more rigid, so they won't break that way. And so you would apply this to the patient's arm before applying the sling and swath. So you could put this on the arm, use some roller gauze to attach it, and then at that point you would then put the sling and swath on as well to secure that elbow and wrist in your patient. I think that's it.